The CDC lifted its mask guidance just a week ago for vaccinated Americans. It really came as a surprise to so many of us. And today you're defending the state's decision to mask for another 3 weeks. And why is that?
Yeah, I'm a little worried about the way the CDC guidelines are going to play out. There still is a pretty good amount of COVID around. There's still 30 or 40,000 cases a day. There are still a few hundred deaths a day. And if everybody followed the guidelines religiously so that vaccinated people went inside and took their masks off, but unvaccinated people wore their masks, then I'd be fine with it. Being sure about that, that's not a world that I'm familiar with. I think we're going to find situations where everybody reads the first line of the guideline and says you can take your mask off and does not read the second line, which says unless you're unvaccinated, in which case you have to wear it. And so you have a little bit of a mess where you have too many people who are not vaccinated, who are not protected in spaces where they're not wearing masks, where they don't have distancing, there's not enough ventilation. And I think that's a recipe for more cases than is necessary. I think in a month, as more and more people get vaccinated, the number of cases will go down, the amount of COVID in the environment will go down, so that even if someone who's unvaccinated isn't wearing a mask, it won't be all that unsafe. So my judgment was, I think, waiting a little bit of time to get people ready for this, get businesses, schools ready for it, and to get the messaging better is the right call.
Yeah, and we certainly see this happening really even now with, businesses trying to update their masking guidance, to align with whatever the CDC / their own individual state policies are. Here in California, we kept it. So nation's major retailers are saying, okay, you have to keep masking if you're, in one of those states that have the policy. But the reality is, even in those other states, right, where they're aligning with CDC guidance, it seems unlikely that most businesses are going to start asking for vaccination cards for people that walk in that don't have a mask on. Right. We already know the situation that has already kind of presented itself with businesses, and so many people that already don't want to wear masks, and have been fraught with those problems. So essentially, kind of you're saying, if we give it just a little bit more time, we can all prepare ourselves for what's to come?
Yeah, I think it's a couple things. I think it's as you say, this is a complicated change, and it came out quickly without a lot of messaging and communication. I can tell you that city and state and even the White House health officials were kind of surprised by it. So it's going to take some time to figure out how to make this work. But a lot of it relies on the honor system. And I wish we could say that that's good enough, but I think we know that it's probably not. And are businesses really going to be checking cards at the door? I don't think so. And even if they do, you can buy a forged card online for $5. So that's a little bit of, we talk about pandemic theater, all the deep cleaning and all the other stuff. It's just, it's just not, we don't have a great system to ensure that the guidelines that they put out are followed. And if they're not followed, you're setting up some risky situations. You're setting up situations where you have too many unvaccinated people who are still at risk of getting COVID and might be carrying COVID, potentially spreading it to other unvaccinated people or even vaccinated people. So even though I'm vaccinated, I'm allowed to now not, at least except for California, I'm allowed to go inside and take my mask off. I'm still not going to do it unless I'm really sure that all the unvaccinated people are wearing their masks. And so paradoxically, you may find situations where the unvaccinated people have their masks off. The vaccinated people, who are probably on average a little more careful, keep their masks on. It's a kind of a bizarro world thing. And so you might say, well, that's the predicament we're going to be in forever. And the answer is not really. If we get more and more people vaccinated, we will reach a point, as we almost are in San Francisco, where there's so little virus around that even if people are acting unsafely, it doesn't matter, because there's just so low a chance that they're going to be infected. We're not quite there yet, but definitely within a month, I think we could be there.
And speaking from someone who lives in a city that has maintained, perhaps being one of the largest cities in the world and maintaining some of the lowest COVID numbers throughout the entire pandemic, it's actually seeing what San Francisco has done and the I guess rigor of everyone that lives there throughout this pandemic. And I know there were some spikes, but it was pretty crazy to see one of the state's largest cities in yellow at the height, perhaps, of the pandemic. And I think that's something to kind of be looked at.
Yeah, no, San Francisco has been very careful all the way along. People have followed the guidelines, followed the science, and it's been hard, but the results are the results. We've had about 530 deaths in San Francisco since this thing started. And if you look at that per capita death rate and you said, what would have happened if the entire country had that per capita death rate? The answer is about 350,000 people would be alive today.
Yeah.
So that's
half as many. Yeah, half as many as the lives lost.
Instead of 600,000 people dead, probably about 200,000 people would have died. Now, San Francisco has a few natural advantages, but most of that difference is that people here have been really careful. And you still see a lot of mask wearing, even outside. And so, if anybody could get away with following the guidelines, it would be a place like San Francisco. There are most other places in the country where the rates of COVID now are much higher than they are here. But even here, I still think it's a little bit dicey.
Now, on the other hand, to all of this, I know CDC's director, Rochelle Walensky, told CNN that, just yesterday, that unvaccinated people need to be honest with themselves. And my understanding of really some of what's played into the guidance that came out from the CDC is the reality that the vaccine is available and the people that want it can get it. And if people are choosing not to get the vaccine and they choose maybe a month from now not to get the vaccine, then it appears I don't know if you really want to call it punishment because it's for public health, but the rules and the restrictions that have been placed on all of the people that are continuing to be vaccinated, it's not fair. And so do you feel that we're going to get a lot more people vaccinated in the next 3 weeks until the state can perhaps catch up with that guidance? Do you feel that there is a likelihood that some people are going to continue not to get vaccinated and that perhaps we'll be in the same place that we are a couple weeks from now? What do you think about all that?
Well, I think sort of all of the above. I think that more people are getting vaccinated. There are some people that waited just because they wanted to wait a little longer and be sure. There are some people that waited until it was more convenient to get the vaccines. There are obviously 12 to 15-year-olds that waited because they weren't eligible. Now they are. So I'm worried about how many unvaccinated people, but the numbers are ticking up pretty good. And every day, as we get more people vaccinated, everybody gets safer, mostly those people who got vaccinated. It's still dangerous to be unvaccinated. And, the variants are nastier than the virus we've faced over the past year. And that's the dominant virus now, is this variant that's more infectious and might even be more serious. And if you are unvaccinated, there's nothing about you that's changed in the last year. You're just as vulnerable. So my hope is that more and more people get vaccinated. I expect that will be true, but there will be, at the end of the day, some people that just choose not to. I think it's no longer, early on we could pin it on it's hard to get the vaccine and maybe it's not accessible in certain communities. Now the vaccine's available pretty much everywhere. There are ways of getting the vaccine. The people can get free Lyft and Uber rides. All that kind of stuff has made it more accessible than it was. And at this point, for someone who's not vaccinated, chances are they've made a choice. I think it's a really bad choice. I think it's a risky choice. And I'm hoping that the new guidelines do promote more and more vaccination. But at the end of the day, someone who's making the choice not to be vaccinated, at least some of them are also going to be the kinds of people who make a choice not to wear a mask. They're making it because they just don't believe the science. They don't think it's as bad as people say. They don't like anybody telling them what to do, whatever the reasons are. I think they're bad reasons. And I think, they may get away with it, but they may get sick and they could get in trouble. But the longer we continue to vaccinate people, the higher the percentage of the population that's vaccinated, the safer everybody is. Obviously, the vaccinated people are massively safe, but even the unvaccinated people get safer due to the kindness of strangers. They get safer because there's just less virus in the community, and they may get away with a really bad choice.
And I suppose there's really a reality that we've been wearing a mask. It's kind of become a way of life for people, especially in California, who's been, I think, for the most part, people are okay with doing it, at least from what I've seen. I haven't seen a lot of big arguments, at least when I go out, and I've been, working since last March, that it's just another 3 weeks. It's just a few weeks, get us set up, get us prepared, let everybody know what the rules are going to be, and then do it.
Yeah, I mean, this feels pretty sensible. I mean, we're talking about wearing a mask for a little while longer. It's not, this is not you taking chemotherapy. I mean, it's not going for major surgery. It's wearing a mask that you've hopefully been doing for the last year and a half, and doing it for a little while longer until we get, what do the numbers need to be? If we can get to a point where 60% of the population is vaccinated, then you got a lot of downward pressure on the number of cases. There'll still be some cases. The unvaccinated people are still walking around and playing a little bit of Russian roulette. There's still possibility they'll get sick and get very sick. But you now have so many people that are vaccinated that the chances that the virus is going to spread and create a surge become very, very low. And I think that's where we want to be. It's a little bit of a judgment call whether we're at that point now, and obviously the CDC believes we are. If you look across the country, 37% of Americans are fully vaccinated. That's not a super high number. Now, the number of people that have some immunity is higher than that, because a fair number of people who are unvaccinated also had prior COVID, and they're at least partly immune to getting it. So maybe, let's say 45 or maybe even 50% actually are, their bodies are better prepared for the virus than they would have been 18 months ago. But you still got a lot of vulnerable people, and you have certain parts of the country where the rates are even lower than that. And so that just strikes me as a little bit dicey to say now is the time to declare victory and go back to normal lives. And to be fair, the CDC is not saying that. The CDC is saying unvaccinated people need to keep wearing the mask. My concern is, are they really going to do that? And can we really, this is life and death stuff, and to trust the honor system seems like a pretty big bet.
Yeah, well, and as states begin to lift their guidance, we can only hope that those people that haven't been vaccinated consider doing that for whatever reason. And I think there's going to be a reality. We're going to get into that point a few weeks from now where people are going to have to make that decision for themselves, and they perhaps already are.
Yeah. Well, it feels very different than 2 months ago, where a lot of people who were unvaccinated were folks who wanted to be and just couldn't be. But we're really now at a place where, I don't have that much sympathy for the argument that we've got to provide better access. It's free. It's pretty much all over. It's not just going to a big stadium. It's going to your local pharmacy, doctor's offices. Places are setting it up so you can get it at a subway station, that kind of stuff. I think we've done a pretty good job since January getting the vaccine out there, making it accessible, educating people. At this point, folks that are not getting vaccinated, I think they know the facts, and for whatever reason, and there's a whole lot of people who are scared of needles or just don't believe the science or whatever it is. But I think at this point, we would say that it's mostly a personal choice. I think it's a bad choice. But I do worry because those folks still are vulnerable, and there's a lot of COVID still floating around in our communities.
Yeah, it's going to be something we're going to have to just continue to watch, and just hope these people, make a good choice for themselves and for others. My vaccine story, I was on my honeymoon in Hawaii just a month ago, and I kind of felt bad at first when I had heard I was in a Walmart. We were just getting some groceries, and they said, we have a couple vaccine doses available. We need people to come take them now. And
aisle 3 vaccine on aisle 3. Huh?
and I waited around, and I saw the pharmacy. I was like within eyes view, and I was looking around, and I said, okay, no one's rushing. I can see that no one's going to the pharmacy. And I hadn't been vaccinated. And I was like, I don't want to take it, especially from Hawaii, where, I understand that their vaccine situation and their public health situation is so much different because they're an island in the middle of really nowhere. But then no one went. And I said, well, I hope they don't waste it. So at that point, I just said, I'm just going to, I told my wife, I'm like, I'm going to go get it. And I did. And they're like, thank you, because we were at the point where we may have had to throw it away. And now I'm protected, and we can move on. And now there's so much. It was so easy. I didn't have to. I showed my insurance card. I didn't get billed for anything. It was just you just go do it, and I feel a lot better about it now.
Yeah, no, I mean, when I got mine, it was like, wow, just that level of anxiety. I'm not going to die of this thing, and 600,000 Americans have. So I don't fully get why people would not do that. I think the science is miraculously good. I think we're now absolutely clear how safe these things are. It's no longer, you could have said when I got my first dose in December, you could have said, it's only been a few months. What do we know about long-term effects? It's now 6 months later. We know these things are just breathtakingly safe and amazingly effective, including against these nastier variants. So the news on the science couldn't be any better. And at this point, for folks to not be vaccinated, they're making a choice. And I, frankly, don't fully understand it.